I've got one more video for you here, and this is again a quick summary, a snippet of what we talked about, or we talk about in our famous lower back pain and sciatica workshop. So what is successful treatment? So successful treatment has some characteristics that you want to think about, and so whether or not you've had treatment in the past, I want you to think about what that was like, and then I also want you to think about, if you have treatment in the future, what you're looking for. So the first thing here is treatment that's successful needs to be individualized. So often in physical therapy and in medicine, we give people protocols. We give them cookie cutter movements or medications or any treatment that's what's good for one is good for all. And I would say that trend is changing, and we have lots of scientific evidence to show that is not the best way to do things. So the number one qualification is it needs to be individualized. In the physical therapy world, that basically means that you might have stenosis in your lower back, but I need to know, what are the movements that you're having a hard time with? When is it affecting you? The things that you're having a hard time with then is going to dictate what treatment or what prescriptive movements or treatment you should get from us. So a gardener with low back pain versus a runner with low back pain versus a walker with low back pain, those should be completely different programs. So if you're in a situation where you're getting, here's 3 exercises that everybody gets on day 1, and go ahead and try those, that's cookie cutter. So that's not individualized. The second characteristic that is very important to successful treatment is that the person that's working with you needs to have a whole body or a global approach. That means that they need to look at the whole body. We just talked about in one of our previous videos how lower back pain is really caused by the feet, the hips, and the upper spine not moving properly. So you need to have somebody that has a perspective to look at the whole body. So if you're in therapy and your back's hurting you and you say, my knee is hurting as well, the person needs to understand how the knee affects the lower back. So a whole body perspective is very important. The third characteristic of successful treatment is that the thing that you're receiving, that you're paying for as a consumer, needs to be educational and empowering. Meaning, I don't want you to need me forever. I want to teach you what to do so that you can find real solutions. And I also want to empower you so that you feel like you can take control. The fourth characteristic is that this treatment needs to be one-on-one. Insurance companies, unfortunately, are dictating the healthcare environment we're in right now, and it's forcing people to increase their volume so that they can maintain their quality of life. And that's unfortunate. So I would say that when you see a physical therapist and you're in a clinic, you should be working with a physical therapist one-on-one. It should not be me seeing you for 10 minutes and then moving on to somebody else, and then you're working with my assistant or my aide or technician. That doesn't make any sense. So one-on-one physical therapy is very important. The fifth thing is it needs to be hands-on. We know there's tons of evidence to show that if I'm not helping you move with my hands, getting a part of your body to loosen up or to be stronger, then you're not going to make progress like you would if we were. So hands-on is very important. And finally, we need hands-on that's combined with movement. So we know that hands-on alone is very good, but it's not as good as if somebody that gets hands-on treatment with movement. So those are my advices for you as far as what to look for in successful treatment. And I hope that you find that, and I hope that you find a solution for your lower back pain.